So I just want to have a run through the Foal CPCR quiz. So thanks for everyone for doing it. You can see here I've got a table of results and it's anonymous. So I don't know who what anyone's score is, but you can see here I can switch into percentage here to see how people got on. So the good news is that generally people did well. Vast majority of you got over 40%. So if this is an assignment, for example, and you don't have passed it. So well done. Just going to take a run through the question. So we can see down at the bottom here for each question what percentage of people got it right. So for example, we can see question 5 here was a little bit problematic, likewise with question 8. So I'm going to do is just take a run through each question and just briefly outline what the reason was for the correct answer. So the first one here was, within 5 minutes of birth, a normal foal should roll onto its sternum, raise its head and exhibit a strong suck reflex. So that's a normal response in this species. A is incorrect because the foal stays lying on its side. You'll find with large animals they have a really strong drive to get into sternal. As soon as they're born, they should roll over onto their front and extend their forelimbs. Nobody went for C because you're correct, I think, in knowing that a neonate should have a strong suck reflex. And then D is correct in terms of the foal rolling onto its sternum, but slow gasping breaths would indicate a problem with ventilation. So B here was the correct answer. And you can see there I've put an explanation in to say that. Okay, next question then was, the easiest site to check the pulse in the newborn foal is, the correct answer was the chest wall directly over the heart. Now you can check the pulse in the femoral artery, but if you imagine a foal immediately after it's born, it's really wet and floppy and covered in uterine fluids, and it can actually be a bit difficult to find the femoral artery because the foal is just so slippery. Likewise, the carotid artery is not palpable in a normal horse because it's so deep. The panradigeal artery and the sublingual artery are both very small and they'd be difficult to find the pulse in. So you did a good job on that. Most people went for the heart. The other thing is, if you're trying to revive a foal, it can be a bit stressful. You can get a bit of an adrenaline rush, trying to do the right thing. And it can actually be quite hard to palpate a pulse. So the advice now, say in human CPCR, is that if the person or the animal in our case is unresponsive and isn't breathing, don't even bother trying to feel for a pulse. If they're not breathing and they're not responding or showing any signs of life, crack on and start CPCR. Don't waste time wondering, can I feel a pulse or not? Grant, next one then was, how critical is it to have 100% oxygen supply when performing CPR? So most people got this one right, which is, if you have it, great, but it's not critical. There's enough oxygen in room air to provide effective CPR or CPCR. We all survive on it normally day to day, so the 20% oxygen in room air is adequate. Now, if you have some, you can go and get it, but it doesn't actually improve patient outcomes if the primary problem is either a cardiac arrhythmia or lack of ventilation. So the most important thing is airway, followed by breathing, followed by circulation. ABC. O for oxygen is useful, nice to have, but never stop CPR to go and get it. Often it's more helpful to, once the foal is revived, you can give it some oxygen by free flow for a few minutes afterwards, but you never ever stop doing compressions or breaths to go and get oxygen. Okay, the explanation was in something similar. Grand. Next one then, all foals should automatically be resuscitated if not breathing after birth. Is that true or false? The correct answer here is false. This is the one that people got confused about. If the animal has a non-survivable deformity, we should never attempt to resuscitate it on welfare grounds. So if the foal is born alive, but say, for example, has severe limb deformities or facial deformities to the point where they'll never be able to feed themselves or move around or live an independent life, then on welfare grounds, we shouldn't put them through resuscitation attempts. If you look in the slides on Foal CPCR, I've got 2 slides of foals that were born alive and were euthanized on welfare grounds due to severe deformities. One has a wry nose where its face is deformed, and the other one had really, really severely deformed forelimbs. So the animal wouldn't have been able to get up. So if you got that right, great. If not, go back and just have a look at those 2 slides and you can see what I mean. You really wouldn't attempt on welfare grounds to put them through anything else. Next one then, which of the following is the optimal setup for securing an airway? So the best option is a cuffed nasotracheal tube. Now, only 35% of you went for that. The reason being is that all the other options are going to increased dead space and are less, they're not creating as good a seal in the foal's airway. So if we take, say, a pump and mask and a second person to close the esophagus, that will stop air being pushed down into the stomach, but we're still having air move up and down the nasal passages and the pharynx, whereas if you've got a cuffed nasotracheal tube or a cuffed orotracheal tube in place, air can't escape from the tube back up the trachea. So more of your effort is going into ventilating the lungs rather than ventilating dead space. Likewise, with a pump and mask, you can't close off the esophagus unless you've got a spare hand. And then a cuffed orotracheal tube is okay, but hopefully your effort is going to be successful and the foal will revive and wake up, and then it'll start to chew your orotracheal tube, possibly before you really want to extubate it. So a cuffed nasotracheal tube is the best option. Why is it so important to give no more than one breath every 3 to 6 seconds? I think most people got this right. Yeah, all of these are correct. If we give 2 rapid breaths, we'll restrict venous return to the heart. We'll give less time for the heart to fill, so our cardiac output will fall. We may overstretch and cause barotrauma to the lung tissue, and we'll end up moving air around in the dead space rather than in and out of the alveolar sacs where ventilation can occur. So all of these harmful things can happen if we ventilate the foal more rapidly. And this is important because, again, if you think of trying to ventilate and resuscitate a foal, it's quite a high stakes situation. Everyone's full of adrenaline, and it's really tempting to sit there and go like breath, 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 as your colleague beside you is hopping up and down 100 times a second on the foal's chest. The person doing the breaths has to stay nice and calm and give really slow breaths. If you have the Foal CPCR app on your phone, it's got a useful little feature in it which allows you to play a sound. I'm going to play it for you now. So I've gone to the Veterinary Advances Foal CPR app, and they have a rhythm guide. So the fast rhythm is the chest compressions, and the slower beat is the breath. So it's basically breath, breath. See how slow they are? Breath, breath. So that's given 15 breaths per minute, which is slow, and it's really important that you recognize just how slow you have to be to ventilate the animal adequately. Okay, so something to keep in mind when you're full of adrenaline. Next one then, which of the following best describes the correct way to perform chest compressions? I think you pretty much all got this right. Yeah, D was the correct answer. Extend your elbows, interlock your fingers, and press with the heel of your hand on the highest point of the ribs. So it's really important when you're doing it that you interlock your fingers, and then it's this part of your hand you're using to press on the foal's chest. You're extending your elbows, so your arms are rigid, and then you're just basically bending at the hips to move your palm of your hand up and down rapidly on the foal's chest, but all the power is coming from your shoulders. If you just use your wrists or your elbows, you'll get tired really rapidly, your chest compressions won't be effective, and you won't actually deliver enough oxygen to the foal's tissues. Even when compressions are performed properly, you're still only going to achieve 30% of normal cardiac output. So fast and hard is the rule. It's really important that your compressions are effective. If you look at part A there, part A is incorrect because you're flexing your elbows. B is incorrect because you're squeezing directly over the heart. We want to put our hand onto the highest point of the chest because that's been shown to give the best effect. And then nobody went for C, which is a technique used, say, in small animals, to be suitable for a cat or a small dog, but you won't be able to get your hand around the sternum in a foal. Okay, next one then was, if 2 people are performing chest CPCR, the chest compressions should continue without pause while the breaths are given. Is that true or false? This is true, okay? This is different from what the advice was 10 or 15 years ago. Chest compressions are required to maintain cardiac output, so just keep going. The person doing the chest compressions, keep going. Now, if you're on your own, you have to stop. You can't simultaneously give breaths and chest compressions. So on your own, it's 15 compressions for 2 breaths. If there's 2 people, one person's breathing for the foal, one person's doing chest compressions, the chest compression person just keeps hammering away until you get tired, or you swap with a colleague every 2 minutes, whichever happens first. So if you're at 1 minute and 30 seconds and your arms are falling off and your technique is failing, step out and let someone else get in. If you're happy to keep going, still swap after 2 minutes if possible, because it is tiring. If you're keeping going for 20 minutes, you know, it's exhausting. So just keep that one in mind. 2 people are there, don't stop the chest compressions. The only time we stop chest compressions is briefly to check for a pulse. So that leads on to the next question. When should we stop chest compressions? Is it true or false to stop every minute? And yeah, you got this correct. You should briefly stop chest compressions once every minute to check for a heartbeat. So you literally just stop compressions, move your fingertips over the heart, feel for a pulse. If you don't feel it, you don't feel the heart beating, get back on your chest compressions immediately. So it's a very short pause, but it's no harm to check. Right, last question. How do you want to feel at the end of an unsuccessful attempt to resuscitate a foal? Even when everything goes perfectly, you're doing well to get over 50% of them back. So it's important to recognize that. I think everyone went for this option. Option D, you did everything right, the team pulled together, everyone knew what to do, and the foal wasn't viable. And that's okay. It's okay to feel like that at the end of it. Whereas A, B, or C is horrible. You know, you couldn't get the equipment, no one knew what to do, people were running around banging into each other. You know, it was just a disappointing mess. That's really horrible. But the only way to avoid A, B, or C is to practice. So don't wait until you have a patient crash or you have a foal that needs to be resuscitated. Get in and practice. We used to, every time we employed a new vet in practice, a new intern or a new veterinary nurse, we used to run a CPCR session, just like we, you know, with a teddy or something. Anything, it can be something simple, but just to make sure everyone knows what the routine is. You can't expect people to figure it out on the day unless you've practiced it. So it's well worth doing. It's quite fun as well. The other thing we used to do in practice was train clients how to provide CPR to foals, because often, you know, by the time they call the vet and you arrive, the foal is born. So you want them to know what to do. And clients really liked that. They appreciated knowing what to do and feeling that. It's not, you know, for clients, it's awful if they're ringing you and there's nothing they can do. They're stuck. It's not how you want them to feel at the end of an attempt. Whereas if they feel they did everything they could and you said to them, look, it just wasn't going to work, it's easier for them. It's very disappointing if they've been waiting all year to have their mare foal and then something goes wrong. I remember going out to a client one night, lovely family, they rang in a panic. Their mare was foaling and everything was going grand and the foal got stuck at the hips. So they rang, they tried to get the foal out and couldn't, and eventually rang. And they weren't only 10 minutes from my house. I went up there and arrived to unfortunately find the foal dead, and just pick up a front foot and pulled his foot straight up towards the ceiling, and his hips freed, and he was born, but he was born dead. And I remember the woman saying to me, God, she said, if I'd just known to do that, we would have saved him, because he was alive, you know, when he was first being delivered. So really felt sorry for them. It was a really horrible situation for them to be in. So what you want to be is as well prepared as you can be, and then you do your best. And if it doesn't work, you think, look, that's fair enough. We did everything we could and it wasn't to be. So one of those things that definitely worth practicing a bit. Okay, so thanks very much for doing the CPCR quiz. It's really helpful. Hopefully you found it useful. If there's anything that still doesn't make sense or is unclear to you in the notes or slides, please pop a question up on the forum for me and I'll run through it for you. Okay, thanks very much.